What's up, everybody? Welcome back to Critical Care Academy. This is Larry. Today's topic we're going to touch on is going to be code blues. Attention, security alert, security alert. Attention, infant protection alarm. Attention, missing persons. Attention, code blue. All right, everybody, welcome back. I'm glad to have you all back today. Today is an interesting topic, one that I like, and today we're going to be talking about code blues. A little background on this for me and why it's so interesting to me personally. So way back when I was a CNA, I worked on a cardiac unit then too, more of a card tele floor. I was probably only, probably a couple months young in the profession. So I was getting this lady up, and when I did, I was getting up for daily weights. And when I got her up, she just, she went real quiet, and this was somebody that had been talking to me all day. And I got to looking at her, and her eyes rolled back in her head, and she just melted like butter right into my arms. And I was so new, and I was just mortified of what was happening. And I had her in my arms, and I didn't know anything more to do than kind of swing her over into the bed. And I immediately hit the code button right then and there. I didn't know anything else to do at the time. So I hit it, and about 400 people showed up in 20 seconds. Amazing how fast that works. And then they all just worked at one time, and it was just beautiful kind of masterpiece of everybody doing what they were supposed to be doing. And I was just, at the time, I was shaking. I didn't know what to do more than just kind of take it in. And it ended up being, it was just a syncable episode. She did not actually code, but for me personally, it was the first time I'd ever even seen anything like that in person. So, it terrified me enough just to hit the button, which was okay because we got the help and all was good in the end. But that moment moving forward in my career, I remember I had to take a 5-minute step away just to regain my composure and my adrenaline rush, kind of take it down a notch. But I remember calling my wife, and I was like telling her all about what had happened, and it was just, I just blabbering like a little schoolgirl. And it was kind of at that moment that I thought, I want to be a part of that one day. Like, I want to do rapid response, and I want to be part of the code team, because it was just this kind of awesome rush, and to see a positive outcome that at the time I didn't really have anything to do with, but these people essentially saved her life, and that was just the most awesome thing I'd ever seen. And that drove my career moving forward. So it is a kind of a sensitive subject for me, and it's one that I enjoy. And as I teach new nurses all about codes and code scenarios, it's something I'm passionate about. So hopefully today we can talk about it a little bit, and we'll talk about roles and everything that goes into a code and why they're important. So I hope you guys enjoy today's topics. So let's get right into it. All right, so on our first topic, what we're going to talk about is preparation. So not every area that you go to has a lot of codes, or not something you experience a lot. Generally on med teles, card tele floors, stuff like that, there's not a lot of codes. These are just kind of these once in a while, once in a blue moon kind of things. So It's not something they think about every day in their process. In critical care, you're going to see it a lot more. In the area that I work in right now, I was just looking at the data last week and from last year. And we as a unit in the hospital, we had the most codes out of anybody. So, for me, I feel like, yeah, I'm in the right place if this is what I want to be a part of. But outside of that, may not want to be a part of that. But I think every nurse in general needs to be prepared for the inevitable, which is going to be a code, and it's going to happen to everybody at one point in time. So our first kind of touch on point is going to be preparation. Each nurse that's taking care of patients needs to be aware of where the supplies, where the code carts, where the Zoll, all these things are in case this happens to your patient. This is not something that takes a lot of time. This is just really awareness for you, saying, I know where to go get this crash cart. I know where the Zoll is. I know where my resources are if I need them. I know where the code button is. These are simple things that you can do to kind of kickstart the process if it happens to you, and to be able to have a more seamless process. So our biggie, know your supplies, know your resources, know where things are at. The second part of this is going to be knowing and being prepared about your patient. This is why it's important to know a little bit of information, a little bit of background. I know you can't know everything about your patients at all times, but knowing your labs, knowing the pertinent information is going to be huge. When these codes happen, the first person they're going to look to is you as the primary nurse to say, what's going on with this patient? And trust me, I've been in those shoes of not being prepared, and somebody asked me a question and I didn't know, especially as a new nurse. It's overwhelming sometimes the amount of stuff you're expected to know. So just kind of having that background knowledge will help this process flow a lot better, and you'll be able to provide the information to the providers when they show up and try to maybe kind of find a corrective action as to why this is happening. So always be prepared. Another part to the preparedness aspect of this is when we say know where the supplies are, I think a big part of this is knowing how to use the supplies. So we use Zoll defibrillators, and it's absolutely crucial to know how to use them. And we'll do another video on exact ins and outs of how to use a defibrillator and how to put the pads on and each of the settings that are on the machine. But knowing the basics of how to hook the patient up is key. So if it's something that you're not familiar with, by all means, ask somebody and just say, hey, can you help me run through this? Because if it's you that's fumbling through it later when the code is happening, you're going to regret never asking how to do it. So knowing how to set it up, knowing how to turn it on, and have it ready. You don't necessarily need to know how to interpret, but as a starting point, setup is key. The crash carts that you use at your facility, ask somebody kind of how the layout is. If you've never seen them, most of them are labeled on the outside as to what's where, what drawer covers what. You've got a drug drawer, you've got IV supplies, you've got an airway drawer, you've got a miscellaneous supplies. You've got a lot of stuff in there, and it's helpful. You may not be the one on the cart at the time, but look at the outside. Just familiarize yourself with things because it's only going to help you more in the long run. After preparedness, I would rank this is kind of an odd one to say, but calmness. So everybody associates code and crazy, code and busy, and just chaotic, which a lot of times it is. But let me tell you this. One thing I have noticed after doing lots and lots of codes over years and time, one thing that's probably the most beneficial for you, for the patient, for every person in the room that's going to be in the code is going to be able to be calm. Not just wiry, crazy all the time and everybody's yelling and this and that. If you can bring in a sense of calmness and you can kind of let people see that it's okay to take a breath, take 1 second just to catch your composure, catch your breath, and then proceed with what you're doing, because you're not going to do any good for anybody if you're in there flailing around and hooping and hollering, and nobody gets anything done that way. The best codes that you'll ever see are calm, composed. People are doing their job, and then the whole process just seems to flow after that. Stress is a breeding ground, and it just, if people see you doing that, they're going to do the same thing, and it catches on, and before you know it, everybody's just in a tizzy. So if you can get to a place where you yourself can feel confident and calm at the same time, you'll do phenomenal. All right, so another big part of code is knowing what roles need to be filled in a code. So this is something they go over in ACLS, and it's one of those things that it makes or breaks your code. If you have 10 people in there and nobody really knows what they're doing, it's very sloppy. But if you have 10 people in there and they all know what role they are assigned, it is well oiled and it works really good, and your outcomes are better. So let's talk about what some of those roles are. So first off, everybody's super familiar with the compressions, and that's usually what people run to when there's a code. They run and they just want to do compressions. It's a pretty straightforward job, so that's why people tend to do it. So, but you have a compressor, and then also remember, you're going to have somebody to relieve your compressor. So having a second person, a third person in rotation to be able to change out as people tire out is going to be key. You're going to need somebody on airway, whether this be another nurse or respiratory therapist, depending on your facility. You're going to need somebody to document. It's harder than it sounds, but you'll need somebody to keep accurate documentation to be able to put the code down. You're going to need somebody to give meds, and that person really just needs to be a dedicated job as to keep track of what they're giving, how often they're giving, and they're going to be communicating back and forth with a documentation person. You're going to need somebody on the code card itself, and that's going to be somebody to pull meds, pull supplies as they ask for them. This could be a nurse, this could be a pharmacist, or it could be a combo of the two depending on what's going on. But it's a pretty busy role as well. You're going to need somebody, this is the key one, that's going to be a leader for the code. Not every code that's called has a provider right there. Sometimes it takes 3, 4, 5 minutes sometimes, depending on where the providers are at, what they're doing. This is where your code team, if you have one, comes in key, because all the members of the code team should be able to run a code as a leader, and they can designate the roles, and then they can also drive the care as well. So these people are key. This is a strong position. You have to know your protocols, and you have to be able to work with people. Like, that's a key part to this whole thing. You can know all the things in the world, but not know how to talk to people, and it won't be successful. This is a very, very, very important key. I stress to people all the time. Know how to communicate with people. Have that rapport with them, and they will follow you in whatever mannerism you need, and you can set the tone for the code. That's an extremely important thing. So all of these roles combined, they make this kind of machine that just operates and does, and we follow the algorithms for what the patient needs, and then in turn what we hope for is a very successful outcome. But you can see how not knowing the roles or not having people perform the roles can dictate the whole outcome of the code in itself. So this is very important in my opinion. One of the big things that I teach people as we're talking about codes and scenarios like codes, people always have these areas where they're not super comfortable, and people don't tend to do things they're not comfortable with. So if you go into a code and you see there's plenty of help, be that good nurse that goes to a role that they're not comfortable with. A lot of people are not comfortable with the meds and the med cart, and it's just because they pull these drawers open and there's 10,000 things in this drawer, and they just in the moment they can't focus and see things. It's all kind of blurry. So if they don't know where it's at, they just kind of freeze up. And they don't want to be that person. Nobody does. But if you've got the resource and you've got the manpower to do these things, go into those other roles. Be with somebody that's doing them and learn it and get proficient at doing it. And the more you do stuff, the easier it's going to come. And then after you've done this a couple times and you have kind of immersed yourself in these different roles, you can feel more confident that every time you walk into a code, you're going to be able to step into any role that is needed. And it may not be that you, after 3 codes, you walk in and you're a team lead and running a code. That's not what I'm saying. That comes over time and your experience and whatever you feel is right for you. But learning the skills of how to manage the airway if there's no respiratory therapist, or even if there is, step over with them, watch them do it. There may be a scenario where there's no respiratory therapist and you need to do that. And only way you're going to do it is to learn it by experience. Nobody reads this all from a book and steps out and says, I'm ready. Let's do this right now. No, hands-on experience by far will get you where you need to go. But I stress this. Learn the things that you're not comfortable with by doing it with somebody else. And you will be amazed at how much you can do. All right, let's talk about some key points to take away from this. Remembering, codes breed stress and anxiety. It's always going to be that way. Nothing you can do to change that except for take a second for yourself. Take a breath. And then start with the calm composure that you need. Yes, there's a lot going on. But if you can have this presentation of, I got this, I'm good, I'm calm, I'm doing it as I need to do it without all the extra stress, you're going to notice that people around you, they're going to start to kind of catch on to that. And they're going to start doing the same things. And that second or two that you take to just take a breath is not going to change the outcome of the patient. People think, I can't even breathe for myself, or the outcome's going to be bad. No, that second or two probably be more beneficial than anything else. That allows you to set yourself, set your tone, set your pace, and then everybody else can start catching on as well. So for me, that's one of the biggest things that I teach is self-composure, calm yourself, and then start doing what you need to do. So another biggie, crowd control. A code being called always has a ton of people there. And sometimes they're in the smallest room possible and you got more square footage of people than you do actual room, and they're all crammed in there. All you need is enough people to get the jobs and the roles fulfilled. If you can get those jobs filled, that's all you need. Ask everybody else to step out. Give yourself some room to work. A lot of times there's so much going on. People are bumping into each other. They can't get the right supplies to the right person. Crowd control is key. Get the people out that don't need to be there. There's a nice way to ask people to leave, and they will respect you if you ask them in a respectful manner. So crowd control is huge. So closed loop communication is pretty important, especially in a scenario like a code. If your provider's there and he says, I need you to give X amount of medication, and you, as that receiving nurse getting that order from them, says, okay, I'm giving X amount of medication, and you have that closed loop communication, it reduces your errors tremendously. You think about all the people hooping and hollering in there, and you can't hear anything, and you mistake the word one for two, and it just, you can see how this gets messy quick. So closed loop communication, huge. So in a code with high stress, mutual respect for your team members. And this goes to say, like, it should be all the time, but especially then, like, that mutual respect you show others will carry on far beyond what you know. They'll leave the scenario and they'll remember that for a long time. Trust me, I've been in that situation, and I remember the people that were super respectful, and it's something I took with me through my career. So pretty big deal. So I think constructive intervention is probably a big one. You're going to have a lot of people that aren't always familiar with what to do, or the right pace or the right depth, or there's a lot of things that they don't know. But if you kind of step in and say, you know, speed the compressions up, a little bit deeper on your compressions, that's the feedback that they need. So you need to do it anyways because, well, that's what the patient needs. But they may not know the difference. So sometimes just providing that intervention, that's key, and that's something that they're going to learn and they're going to take with them into the next time and the next time after that. And then I also think that a kind of debriefing at the end is key. There's a lot of times we've been in codes and people have said, what could I have done differently? Is there something more that I should have done, could have done? And just like anything else, there's no shoulda, woulda, couldas at the end. But a debriefing and going over all the things that were done in the moment, it's just a blur. But afterwards is a time where you can kind of soak in and you can retain information about what you did. So I think debriefing after codes is a pretty important thing after everybody's kind of gone through their emotional wind downs and kind of drop their adrenaline kick for a little bit. But everybody can learn to do stuff better. Anybody included. It doesn't matter if you've been doing it 100 years. There's always ways, and everything is always constantly evolving. So we can always find a way to change things and make things better and more efficient. And in turn, we come out with better patient outcomes. So why would you not? All right, guys. I hope today's topic was helpful to you. I think it's one of those things that we can always talk about more and more and more, and we could always take something away from it. But I'm hoping that if I can share some insight as to what would be helpful in your future, kind of based off what I've learned over time, I'm hoping that you'll take it with you forward and you'll become this great team lead in a code, and you will be able to eventually run everything that you need. And it's like anything else. People will follow you, and they will appreciate you showing up, and they'll know, hey, they got this. I've been with them. I know how they roll. So I'm hoping this will help you take it into that direction. And if there's anything that you guys ever need, please ask me. Please let me know. I'll be glad to help you in any way I can. Otherwise, we'll see you on the next video.